Dear students, it is the fourth video for week 13, and in this video we are going to talk about most common diseases found in Pakistan. In the previous video third, we came to know about some general information about the infectious diseases, that some diseases are born from contaminated food and water, some because of the contact of the different insects, and some due to the bite of the animals, and then there are certain other diseases like cancer which happen because of certain other issues. Well, Pakistan, according to WHO, World Health Organization, is ranked 122 among the 119 countries of the world in terms of the health standards, which is not much appreciable as compared to the public. The health standard should be there. Well, in Pakistan, the geographical location, the environment, and lack of health and hygiene facilities, certain diseases are very common and equally dangerous. Well, these diseases, including the currently added COVID-19, dengue fever, tuberculosis, diabetes, cancer, hepatitis A and E, clear? So these are the most common diseases in Pakistan. Well, one by one, COVID-19, you all are aware that it is a viral disease started from China, Wuhan. Later on, it was opened in Italy and then spread into the entire world. Currently, America, India, European countries like UK, Asian countries, they are completely obsessed by this disease, and daily the death toll is increasing, whereas the countries like Pakistan had taken very serious steps, although it had a worst effect on their economies. The smart lockdowns, the universities and colleges were locked, whereas the people were prevented from meeting one another, and social distancing was made necessary. Yes, the fight against the COVID-19, this pandemic, is continued. Well, then dengue fever. Just before the spreading of COVID-19, dengue used to be a very common danger for the people, and especially with the thickly populated areas like Rawalpindi, Lahore, Karachi, and the neighboring areas, dengue was really a worst and it killed lots of people. Dengue fever is a mosquito borne disease transmitted by a mosquito. It cannot spread from one person to other, and its symptoms are high fever, headache, muscle pain, vomiting, and skin rashes. Dengue fever is severe from virus to virus. Sometimes it causes serious disease, including enlargement of liver and the failure of the circulatory system in the blood circulation system if it is not treated properly. In 2001, it broke out in Pakistan. Around 250,000 people were affected, and in from 2009 to 2010, dengue fever caused almost 348 deaths in Pakistan. Well, government of Pakistan, especially the previous governments, took a very serious step to control dengue and to devise its vaccine that was not included yet. Government strengthened the surveillance system, preventive measures, improved clinical management. Fine. So the steps of that government was really good. Tuberculosis. It is an infectious disease. It affects on the lungs and it spreads to the other people by coughing and sneezing. According to World Health Organization, two-thirds of the people in the world die because of this disease having not the treatment. It is a really common disease in Pakistan. Pakistan is ranked 8th out of the 22 countries in the world where the tuberculosis is prevailing. 4,20,000 new tuberculosis cases were reported almost 4 years ago, and it is apprehended that recently this calculation may have increased a lot. National TB control program is working hard to prevent the TB. It provides training to the doctors, paramedical staff, lab technicians, and it also provides free medicine in certain areas in certain cases. Diabetes. Pakistan has Pakistan has the highest diabetes rates in South Asia. About 7 million people are affected by this disease. This disease affects the patient's ability to respond to the hormone insulin, which then causes unusual metabolism. These are the medical terms mean it affects on the liver and disturbs the insulin system that regulates sugar, and regulation of the sugar actually is the control of the energy. In short, the diabetes uh, disturbs the internal energy system, and thus the vital parts like brain, heart, lungs, stomach, urine, these areas, gallbladder, these areas are affected, and the person becomes mortified or fragile, clear. And if some other diseases is coupled with diabetes, then the fatal rate increases, mean person can die. And especially in COVID-19, those people who had the double diseases like diabetes, they couldn't survive. Cancer, it causes 8% of the deaths in entire Pakistan. It is the major health problem in Pakistan. Breast cancer, lung cancers are the common issues. One in every 9 women in Pakistan has the breast cancer, whereas the lung cancers and the teeth, mouth, highest consumption of tobacco, According to 2013, since 2013, Pakistan has started compiling the data of the health patients. In 2016, since 2016, 18 cancer hospitals are working in Pakistan, and these hospitals provide 80% of the cancer treatment in Pakistan. But unfortunately, because the cancer treatment is very expensive, Aga Khan, Shaukat Khanum, these are the leading hospitals. But people cannot afford, although in Shaukat Khanum and the related projects, people donate a lot. Hepatitis A and E. Hepatitis A and E are still the common disease in Pakistan, whereas in the world people have searched their uh, medicine and the vaccine is available. It is a viral disease. It spreads because of the contaminated water or unhealthy food, and it really affects on the liver, and finally the generation of the uh, blood is affected, and slowly they destroy the immune system. I think you have understood about the most common diseases found in Pakistan. We at this point should learn that all the diseases are curable if proper medication is made, and we should follow the proper health directions. Thank you very much.